Okay, hi. I'm not here to lecture you about TURP because all the surgeons here are how to do, knows how to do TURP, and residents are learning how to do it. I'm here to tell you facts and defend the TURP in front of several new techniques. So I will not develop the technique of itself of this procedure since you all have a long experience in this field. Everyone has his own skills and tricks to do TURP. You are all familiar with the standard TURP operation. I will enumerate the pros and cons of the surgical procedure as well as its complication to allow you to choose the procedure that suits your requirements by the end of this session. Even if you like the green light, for example, the most, you will not be able to do it if you don't have the equipments. So I think you have the opportunity to do what you have in your hospital, I think. So that you are of prostate is a surgeon skills dependent technique with all of the meaning of skills. You have to know how to do it. If you are good in doing it, the results will be maybe good, maybe. So normally the procedure itself lasts 60 to 90 minutes if everything is okay in the OR. It is an effective and durable solution for BPH treatment. 3 to 10 years, generally more to 3 years. The treatment is needed because of the prostate, as you all know, continues to grow with time and re-obstruct the urethra. So maybe the patient will be readmitted to do it a second time. Recently, the technique is being improved by the arrival of bipolar resection with less morbidity. Foley catheter is left in place maximum 48 hours generally these times. It is a technique widely applied among urologists. Everybody knows how to do it. The cost is affordable if you compare it with other procedures, and generally considers a safe procedure with short learning curve. You have to see or do at least 20 to know how to do it. To compare it with other procedures with standard TURP, to compare it with other procedures, a procedure should be non-inferior in results with less morbidity, I think. Technically simple with standardized technique or technology, because this procedure is very good in my opinion, the TURP. So with TURP, you have an immediate result directly after ablation of the catheter. We have this experience, everybody have it. Complete recovery takes around 4 weeks. In my opinion, the TURP should be considered a minimally invasive procedure. As a major operative procedure, because after all, it's a major one. TURP has been associated with significant perioperative morbidity. Lately, it has been somehow pushed to sidelines for modern laser ablation techniques. Complications. You have it all in the slide. Dry orgasm, bleeding is the most common complication of readmission. Post-operative retention, stricture, clot infection, difficulty holding urine, so incontinence, blood transfusion, bladder neck contracture or more, DVT, and TURP syndrome. Retreatment is up to 14% after 5 years. Conclusion. Does TURP remain the method of choice for surgical management of bladder outlet obstruction? You will answer this after the ending of the session. Is TURP still the gold standard procedure? In all cases, it's one of the most common procedure worldwide till now. Thank you.
Thank you, Maher.